Hi, I'm Derry from Derry Brown Physio Fitness, and today we're going to talk about shoulder. So your shoulder is a ball and socket joint, similar to your hip, but the socket on the shoulder is much more shallow. I've heard it described like a golf ball and a golf tee, which allows for a much greater range of movement, but that risk of instability is also much greater. So stabilising the shoulder, we've got a complex of 4 muscles known as your rotator cuff. So there's 4 muscles, 2 that sit on the back, 1 on the top, and 1 on the front, deep within the shoulder, and they stabilise and guide the shoulder as it's moving. You've then got your prime movers, your heavy, strong muscles, your chest, your deltoid that sits over the top, and that's what will provide the force when you're doing things like your bench and shoulder pressing. So one of the biggest problems that we see is people in the gym, weight training, really strong at the front, and they're forwards in this posture, and they're weak at the back, and that's changing the posture of the shoulder. So if we have a look at the shoulder joint here, we've got your shoulder blade sitting on the back, collarbone on the front, and then the top of the arm bone here. We've also got this small gap underneath what's called your acromion process here, and there's a few muscle tendons that actually pass through this gap. So if you're changing the posture of the shoulder, perhaps if you're weak at the back and that's causing your shoulder blade to come forwards, you're reducing the size of that gap, you're potentially going to irritate structures in there with what some people call impingement. So this is the reason why for a lot of exercises I talk about that superhero chest. You want that chest up, shoulder blades positioned back and down, which is going to keep that good posture of the shoulder and stop you getting that shoulder pain. The other thing that we can do is cuff strengthening exercises. So you could do a shoulder press with a resistance band, wrapping that around the hands like that, pulling apart, so we're activating the back of the shoulder, and then we can press through range, or you can strengthen the cuff with exercises like this. Muscle imbalance and therefore poor lifting posture is going to be one of the main causes of shoulder pain, so that's something you want to watch out for. If you've got any questions about your pain and how it's stopping you with your training, or any more questions about the shoulder, feel free to send me a message.